Hi, my name is David Emerson. I'm a long-term multiple myeloma survivor, myeloma coach, and director of People Beating Cancer. Welcome to the vlog post about one of my favorite topics, Chemobrain. Chemobrain is a fairly well-documented side effect of high-dose or aggressive chemotherapy. I'm making this recording in July of 2020. It wasn't always, Chemobrain was not always an established side effect. Basically, all of the past 20 years, this particular side effect, Chemobrain, or the formal term chemotherapy-induced cognitive dysfunction, has been debated, and in some quarters it still is debated. It's also important to point out that in addition to myeloma, there are survivors, in particular breast cancer survivors who undergo high-dose chemotherapy, also who have this side effect, cognitive dysfunction. Just so everyone knows, that's essentially what's referred to as frontal, those side effects such as multitasking, facial recognition, basic memory problems, certainly word search, those kinds of things. Two things I want to say in this particular vlog post. On the one hand, I think that conventional oncology should understand all possible side effects, especially something as debilitating as Chemobrain. However, it doesn't help for me to be angry and for me to be mystified as to why conventional oncology doesn't get it when it comes to Chemobrain. Essentially, it is a difficult enough side effect to establish. Difficult from the standpoint of, in my case in particular, I didn't really begin noticing symptoms for a couple of years after my high-dose chemotherapy. So my point is, conventional oncology doesn't really pay attention. They'll pay attention for side effects that happen while they're giving you chemo, maybe for 6 months after chemo administration. In my case, and most myeloma patients, we undergo induction therapy over the period of months, 3, 4, 5 months, then maybe take a few months break, sometimes more chemotherapy in the form of an autologous stem cell transplant. Some people then undergo long-term, low-dose maintenance therapy. My point is, it's possible that it's months or years before Chemobrain really takes hold. By that time, your oncologist is long gone. He or she is on to the next myeloma patient survivor. So, documenting this side effect is difficult. The good news is that there are documented therapies to improve, perhaps even cure, your cerebral dysfunction, your cognitive dysfunction. Those documented benefits, therapies are vitamin D3, brain healthy nutrition, I think I'm pronouncing this right, nootropics, brain games, and exercise. Lots of supplements are said to be brain healthy, help brain function. Brain games, I swear by. In my case, every single morning, brain games are delivered to my inbox. Brain HQ, I think they're great. So, all to say, Chemobrain, bad. Therapies, evidence-based but non-conventional therapies, good. If you have any more questions, at all about what I've said, scroll down, send me an email, question and comment, and I will reply to you ASAP. Thank you very much.